Welcome to the Wellness Effect. Now, we all know we need to have a medical aid, but do we really understand what they are? With me today is Marlize Johnstone, an independent broker with many years of experience. Marlize, thank you so much for joining us today.
A pleasure.
So, Marlize, I think today we're going to get into the basics of what a medical aid is, but in your opinion, what is a medical aid?
So medical aid is overseen by the Council for Medical Schemes, and it's regulated by the Medical Schemes Act. Anyone can belong to a medical aid. Medical aid can't refuse a member to join a medical scheme. And then we're looking, in my environment, I'm looking at an open market. I'm not in a closed market or a closed scheme market. So medical schemes are managed and administered by trustees, where they receive a premium, and for the premium, the members get paid a benefit when they are admitted to hospital or they need medical care in a private sector. So members that belong to a medical scheme has the advantage that they can enjoy medical care benefits from the private sector.
Amazing. I think you've given us possibly the best technical understanding of what a medical aid is.
Yes.
And I really appreciate that. Now, the Gen Z's the youngest population in the world right now, and by 2050, Africa will have the youngest population in the world. How would you help them see the benefit of having a medical aid at their age? Because I think a lot of the time they're thinking, oh, I'm too young, I don't need it. But then life hits them and they realize, oh, I actually needed it earlier. So what sort of advice would you give to the younger population about the relevance and the importance of a medical aid?
So the general take for the younger public is that they will not become ill. So they don't need medical aid benefits when they are hospitalized because their risk towards illness is so low. So they need medical aid as far as accidents is related because that is their risk. And there is alternative options that can give them accident-related benefits that's much more affordable than a medical aid. And some of the younger generation or the members of the younger generation don't want to necessarily pay high fees towards getting that benefits in a private care hospital, so they opt for alternative options. But when they do need medical aid cover as far as illness, when they become older, it comes at a cost. Because after the age of 35, you start paying late unit penalties for medical aid premiums. So whereby the general public, there's no discrimination on premiums. Every member of the public, or when you join a medical aid, you pay the same premium depending on your plan option. But when you reach that age that you're over and above 35, then a penalty starts to apply, and then it becomes expensive. When you need medical care most, you pay more for that or for the benefits.
Sure, you mentioned something important around, by the age of 35, they start paying a little bit more if they haven't been in a medical aid before that. Why is that the case?
Because the medical fund look at the risk of the members. The younger members subsidize the older members, where normally illness claims ratio is higher, where they receive premiums from the younger generation to fund those higher aged members' claims as far as illnesses is concerned. But there's also a cross-subsidy from the older generation to the younger generation, because the younger generation obviously are more active. They play sports, so they've got injuries as far as that is concerned, which they get hospitalized for, knee injuries, shoulder injuries, they're a little bit more adventurous. So, there is a cross-subsidy going on with that. So when you reach the age of 35 and you then have other illnesses that arises due to age, as far as chronic conditions, blood pressure, cholesterol, due to lifestyle changes or lifestyle that has not been maintained during your younger years, then you need that medical care, or even benefits like oncology with your cancer benefits, heart conditions, joint problems. Now you, at that older age, you want to join the medical aid because you have all these conditions. So let's say, for instance, you join the medical aid after 35, then they can impose medical aid late joiner penalties, which means that if you have not belonged to a medical aid in your prior years, 1 to 4 years penalty. So let's say, for instance, you're 40, then you subtract the 35 from that. Now you need to get credited years of 5 years. Otherwise, you get a penalty on that. So if you have belonged to a medical aid for 1 year, you subtract the 1 year from the 5 years, you get a number of 4 years which you will be penalized for, and then there's different penalties that apply. So if you have not belonged to a medical aid for 1 to 4 years, you'll get a 5% penalty. For 5 to 14 years, you get a 25% penalty. From 15 to 24 years, you get a 50% penalty, and then above 25 years, you get a 75% penalty. So that helps us to avoid that when people are 60 or 70, that they join the fund and they use all the benefits as far as their illnesses, that they pay an additional premium towards that benefit that they will use in excess that other members not necessarily will use. So those are the things that we need to make sure that, when you're young, even if you join the core benefits, simple benefits, the basic stuff that will cover your basic needs in hospital or out of hospital, that you don't have those late joiner penalties later in life when you need medical aid mostly.
Amazing. I think you've touched on a very good point, that it's better to just get onto a medical aid at a young age. So to our younger viewers, I think it's essential for them to know that. Talk to me about these waiting periods. How does that work?
So if you haven't belonged to a medical aid for 90 days or longer, there's a 3 months general waiting period that will apply on your membership. During that 3 months general period, the scheme can say, do they want to cover PMBs, that's prescribed minimum benefits, in a private facility or in a state facility. So that is up to the scheme's rule if they will cover your prescribed minimum benefits in a state facility or a private facility. And if you have any specific condition, that specific condition can also be excluded or will be excluded for 12 months specifically. If you belong to a different medical aid, so let's say, for instance, you belong to medical aid A, and you want to, by free choice, move to medical aid B, then the scheme can apply a 3 months general waiting period because it's by choice that you're moving between funds. And let's say, for instance, on scheme A, you had a specific condition which was diagnosed and you've been on that scheme for 4 months. The balance of specific condition will be then transferred to scheme B, where you will then have to wait the 8 months remainder in this specific scenario for your medical benefits to be covered in full for that specific condition. So we have 3 months general waiting periods and 12 months specific condition waiting periods according to the Council of Medical Schemes rules that applies.
I see. So what's the difference between a medical aid and medical insurance products?
So medical aid is regulated by the Medical Schemes Act, and the Council for Medical Schemes oversees that, whereby a health insurance policy is either a non-life or a life, which is underwritten by the Short-Term Insurance Act or the Long-Term Insurance Act. The medical scheme benefit has a board of trustees, which the members chooses. It's a non-profitable organization, and the premiums are pooled to benefit all the members that joins the scheme, which their claims are paid from. Whereby with the health insurance policy doesn't pay for an illness benefit specifically in hospital. It pays for accidental benefits or your gaps in differences in premiums. And in certain instances, they do pay for illness like a heart condition or a stroke condition, which is limited to specific amounts. I usually explain this in simple terms for the person on street, because there's a huge misconception of, I belong to a health insurance plan. But the moment that the member ends up in hospital for an illness, they get this rude awakening that their health insurance plan doesn't cover this illness benefit. So my simple explanation is for that is, where medical aid covers everything internally and external forces, the health insurance covers only external forces, or a specific limited amount per day that you're in hospital, but not necessarily well-aid fund for the surgeon or the operation, or the procedures that is linked to the overall comprehensive health for the member that is on a medical aid. So the insurance portion covers that daily limits and only for external forces.
Would you recommend individuals having both medical aid and medical health insurance?
So in the medical health insurance space, we also are familiar with the gap cover.
Yes.
Which covers all your co-payments, which the medical aid not necessarily covers. Which, in my opinion, we find that more often that medical aid starts to impose co-payments to try and keep the premium as low as possible for the client. So they don't have these excessive payouts on procedures where the members starts paying those co-payments. Where the members now can, if they downgrade their option, or they look at, benefit changes within their options that can benefit them, and link the gap cover product to their medical aid, they've got a more comprehensive type of cover going on for them as members, which makes it more affordable with them, but has that safety net of the gap cover that will, sort out those differences or those places where the medical aid doesn't necessarily cover their benefits. So, yeah, to enjoy both of them, yes, you can. You can't belong to two medical aids at once. You're only allowed one medical aid.
I like that you mentioned it's essential to have the medical aid and maybe having the gap cover to offset elements that the medical aid doesn't fully cover.
Definitely. On the medical aid side, you also get reference pricing lists where you get a list of codes that's linked to certain procedures. And those codes or procedures are linked to a specific limit within each procedure that your medical aid will cover. So we do get from time to time, you will see on your medical aid options, you get a 100% option or a 200% option or a 300% option. That members can't afford to buy the 200 or the 300% option. So then they do choose the 100% option, but with that link of the gap cover, which is a health insurance product, they have then the ability where that specialist charged them above the health rates, that they can claim that portion back then from their gap covers. That gives them a little bit of best of both worlds scenario.
How does a medical aid benefit my wellness?
So for me personally, obviously it gives me that financial security that if anything happens to one of my loved ones, I know that I've got access to private care facilities immediately. I don't need to sit in a waiting room or be scared that one of my loved ones won't get the necessary health care immediately when they need it most. So that gives me that financial freedom and that financial security that I know that my loved ones can get immediate health care when they need it most. Secondly is we can, on most medical schemes, they've got screening benefits or health platform benefits, or they call it different things, where you can check your health regularly. So you can have that early detection to make sure that you've got preventative care in place. So you do your blood works annually, your high blood pressure, your sugar, your cholesterol testing, your BMI testing. Women can do their mammograms, bone density tests. They even do stool pathology tests now where we can have early detection on colon cancer. So we've got that safety net that we can have preventative care beforehand to make sure, that our families are cared for. And that's benefits that people or members that doesn't belong to a medical aid or don't belong to a medical aid, they don't necessarily do that out of their own pocket, whereby your medical aid funds that from the risk premium. It's not coming from your medical savings account or from your day-to-day benefits. And it gives you the opportunity to manage those beforehand. And if they do detect certain illnesses that's diagnosed with you, professional, if they detect an illness that's diagnosed with you, then you can go through the preventative caring of using the correct chronic medication, which is also covered by your medical aid's core benefits, that you've got access to chronic medication to manage that. So that gives you that longevity over term to manage your health better. Where if you don't belong to a medical aid, you won't necessarily do that because you want to save from pocket. So, I think that's the reasons why, why I have a medical aid and why I choose my family to have a medical aid.
Yeah. I think you've covered quite holistically that it actually provides peace of mind.
Yes.
The peace of mind to know that should anything happen, you're financially covered. The peace of mind to know that you can go for tests and work on preventative care. So, Shia, thank you for such an engaging conversation, particularly around this hot topic right now around medical aids, the benefits that they support an individual. Thanks for watching. Next time we continue discussing medical aids, so don't miss it. Remember to subscribe. Till next time. BankMed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by BankMed. Yours in good health.